I'm Tom Collura, and we're at the Florida Mental Health Counselors Association meeting here in Orlando. And I've just given a presentation on some exciting new science and mental health techniques that we're using to explore the brain mechanisms of decision making and emotional responses, and how EEG, the electroencephalogram, can be used with brain imaging to assist counselors and therapists work with their clients.
It was a wonderful presentation, and we all learned about the multiple applications that can be provided and can be used by counselors. However, many believe that these are too complex and difficult to use, but you were suggesting that we have ways to use this with counselors.
Yes.
How?
Well, technology has advanced now to the point where, yeah, if you want to put a whole head full of electrodes and bring a technician in and do EEGs, that's very valuable, it's useful. But we also have new technologies that are much more affordable. For example, there's wireless products along the lines of this type of a device, which counselors now can use and get good, high-quality electroencephalographic recordings from their clients and use them clinically.
I hear you, but now let me understand, why would a counselor be interested in using this type of technology in his or her practice?
Well, that's a very good question. Surely it hasn't been much used these days, and most counselors have never heard of EEG. But any counselor who has asked themselves, I wish I knew what was going on in my client's head right now, and how are they responding to what I'm saying, or how is their brain relating to what they're telling me, the new EEG technology can put things this profound, yet this simple, into the hands of clinicians.
And when you say this profound, you are really talking about looking, literally looking into specific part of the brain reaction to the ongoing counseling situation.
Yes, absolutely. What we're specifically seeing is the pre-conscious brain activity that produces the emotions and produces the thoughts and produces the behaviors. So we're able to see these at a very primitive level, and by putting clients through different interventions, different challenges, different types of dialogues, see how their brain is actually performing its function. We look at things such as approach versus avoidance, or safe versus unsafe judgments. And these judgments are not just related to whether something in the room is dangerous or not. Are my thoughts safe? Can I trust my judgments? Can I trust my emotions? How am I responding to a clinical intervention? And these types of very simple questions now can be answered, alter the course of therapeutic intervention, and help clients navigate their way toward more effective brain functioning.
And actually, what you are suggesting then is that we can have the surface communication, which is the verbal, social, what we see, hear, smell, feel, but also the underlying communication, which is how specific parts of the brain are responding in terms of intensity, acceleration, emphasis to the same issue.
Absolutely, and we do see that. I can give a couple examples. For example, we had a client who was very anxious and very withdrawn and avoidant in her behavior. And when the other counselor I was working with began to coach this client and try to instill in her her intrinsic abilities, her intrinsic qualities, the EEG showed that she was reacting negatively, very strongly, to that very intervention. And when I asked the client, you're not buying any of this, are you? And she said, no, I'm not buying a word of it. And I asked why, and she recited the textbook answers. Because I've heard it before, this never works. Every time someone starts talking to me that way, it's a waste of my time. So I was able to reflect to the client that I understood where she was coming from, and reflected to the other counselor that the client wasn't buying into that particular sequence. And the client then kind of brightened up and pointed over in my direction and said, see, he gets it. So this became a minor breakthrough in a course of dialogue with this one particular client. It's a very interesting outcome.
So actually that gives us an opportunity to find new ways to look at known issues. Like for
Yes.
example, you talk about a person who was sort of avoidant or
Yes.
was shy, and the traditional approaches don't seem to fit. But you can actually say, okay, I got you. This is what I see on this machine that we call the neurofeedback or EEG machine, and maybe a different type of training can help you
Yes.
improve upon that.
Yes, and it could be a different type of intervention. One example, a very dramatic example of a client who came for basically attention and peak performance enhancement. When analyzed using these new methods, we discovered that she had a rather normal negative reaction to the idea of being fat. But when we introduced the word obese, her brain reacted very, very strongly. And that was in contrast to her verbal report, where she basically just said, well, I just don't think people should be obese. It took a little further probing to discover that this client actually was hiding an eating disorder. And her internal brain reaction, which she was denying either to herself or certainly to the therapist, really betrayed a very, very strong emotional reaction. When she was asked what her behavior is with regard to her feelings and history of obesity, she revealed bulimic activity. And then she was referred for eating disorder, where she had come in for an entirely different purpose.
Very good. So what would you then like to suggest to counselors?
I think the first thing counselors want and need to do is to learn about the brain. Whether you use equipment or not, learn about the functions of the brain, become neuroscience based. When you talk with a client, when you work with a client, when you assess a client, even without EEG equipment, there is a neuroscience basis that you can identify, and this can help guide your interventions. The next step, of course, is to be looking toward EEG, neurofeedback, biofeedback, and also use neuroscience to inform interventions such as EMDR, NLP, hypnotherapy, guided visualizations, all these different interventions. They can all be informed and improved with an awareness of the neuroscience.
Fantastic. Anything else that we will need to add?
Well, I think it's a coincidence. It's a turn of a century, and I think it is the turn of an era. The 1990s was considered the decade of the brain, and that's when I went into my third decade of work with the brain. And now that we're emerging into the 21st century, we have things such as wearable brain hardware and software that allows us to image brain activity. This would have been unthinkable 10 years ago. So counselors want to be aware now of the instruments, the training, the knowledge, and the fact that this is coming to stay. And neurofeedback, EEG, and neuroscience are going to become a foundation in mental health.